Hello, Mr. Jones. My name's Danielle. I'm going to be your nurse for today. I'm going to go ahead and pull the curtain for patient privacy. I'm going to verify 2 patient identifiers. May I please see your wristband? Can you tell me your first and last name? Jacob Jones and your birthday? 8/13/78, perfect. And I'm here today to give you an intramuscular injection of morphine for your pain. I'm going to go ahead and verify the physician's orders, which is 6 milligrams of morphine, intramuscular 1 dose. And I am using a 20 gauge needle, and this needle is a 1 ml needle. I have 6 milligrams for the order, but have 4 milligrams on hand. So I'm going to do 1.5 mLs. So I'm going to do 1 full ml of this and then a half ml to match up to the amount of milligrams. Mr. Jones, when I do the injection, you will feel a little bit of burning or stinging sensation. That is normal. Some side effects will be headache, nausea, constipation. If you have any adverse side effects such as palpitations or anything like that, please let me know. Other than that, do you have any allergies such as medication, food allergies, or environmental? No? Perfect. And do you have any questions before we get started? No? Okay, perfect. I'm going to go ahead and verify on the Mars again, 6 milligram morphine, 1 dose, intramuscular. I am going to do 1.5 of the syringes. So I'm going to go ahead and do hand hygiene. Okay, I'm going to go ahead and put my gloves on. Do you have any questions before we get started? No? Perfect. And I'm going to go ahead and do it in the ventral gluteal site. If you got injections often, I would go ahead and rotate if I needed to. I'm going to go ahead and palpate the site for any bruising or tenderness or hardness. And then I'm going to look for any edema, bruising, or inflammation on the site. I don't see any of that, so I'm going to go ahead and use that site. So I'm going to go ahead and wipe the top of my medication off with a cotton swab, wiping off. So I'm going to pull back 1 ml of air, 1 ml of air. I'm going to hold the injection like a dart. Go ahead and inject that air into there. I'm going to invert, pull back 1 ml of medication. I have 1 ml of morphine, 1 ml. And then I'll fill it up again halfway to 0.5 mLs to do a total of 1.5 mLs. So I'm going to go ahead and take the heel of my wrist on the greater trochanter of the hip. I'm going to use, with my wrist perpendicular to the femur, I'm going to point my thumb towards the groin index, and with my index finger superior to the iliac crest, my middle finger is going to go along the iliac crest toward the buttocks, and my index finger and middle finger along the iliac crest are going to form a V shape, and that's where I'm going to go ahead and do my injection in the V shape. I'm going to take a cotton swab and go in a circular motion to clean the site, in a circular motion. After I've cleaned the site, I can't let anything else touch it or contaminate it or anything. In that V shape, I'm going to go ahead and remove the cap with my thumb. And I'm going to tell the patient to relax the site. And I'm going to go ahead and inject. I'm going to pull back the plunger for 5 to 10 seconds If there's no blood, I'm going to go ahead and inject. That means that I haven't hit a vein or artery. Okay, and I'm going to go ahead and inject for 10 seconds per ml. Injecting 10 seconds per ml. And everything is injected. I'm going to go ahead and hold the gauze, but I'm not going to massage the area or anything. Just holding the gauze there for a couple seconds. I'm not going to recap or anything. I'm going to throw my needle and the cap into the sharps container to dispose of it. And Mr. Jones, do you feel okay? Perfect. Okay, I'm going to go ahead and remove my gloves. I'm going to go ahead and hand hygiene. Hand hygiene, I'm documenting in the MAR system what I just did. And I'm going to verify the patient's okay one more time. Mr. Jones, are you feeling okay? Perfect. And I will come back and check on you in just a little bit. Have a good day.